Hello, my name is Dr. Judy Boughey. I'm a professor of surgery at the Mayo Clinic in Rochester, Minnesota. So increasingly, with improvements in screening and improvements with diagnostic imaging, we are finding more patients that are diagnosed with more than one area of breast cancer within the breast, or what's called multiple ipsilateral breast cancer. And when we look at historical studies, patients with multiple ipsilateral breast cancer who were treated with breast-conserving therapy had high rates of local recurrence. This has resulted in most surgeons recommending mastectomy for many patients that have multiple areas of disease within one breast. However, some more recent retrospective studies have shown a far more acceptable local recurrence rate with the use of breast-conserving therapy for patients with multiple ipsilateral breast cancer. Therefore, we designed the ACOSOG Z11102 clinical trial as a prospective, single-arm Phase 2 study to evaluate the role of breast-conserving therapy for women with multiple ipsilateral breast cancer. We enrolled patients who were aged 40 and older that had 2 or 3 foci of biopsy-proven breast cancer with at least one focus of invasive disease and the additional foci of either DCIS or invasive breast cancer. These had to be separated by at least 2 centimeters of normal breast tissue on imaging. These patients were treated with breast-conserving surgery via a single lumpectomy or multiple site lumpectomy, and then the protocol required whole breast radiation with radiation boost to each of the lumpectomy beds. Neoadjuvant therapy was not allowed, and adjuvant therapy was at the discretion of the treating medical oncologist, but for ER-positive disease, endocrine therapy was recommended. With a 5-year follow-up, we found that the local recurrence rate at 5 years was 3.1%, with the confidence intervals ranging from 1.3 to 6.4%. This remains below the clinically accepted 8% local recurrence rate at 5 years, which was defined by the protocol. So overall, this is a positive study and opens up for patients with multiple ipsilateral breast cancer that they can consider their preferences between breast conservation therapy versus mastectomy. When we look at the study population, we see that the majority of patients had ER-positive, HER2-negative disease, and most were clinically node negative, and the vast majority of patients had just 2 foci of breast cancer. So I think the patients that we will implement this most in practice will be those patients that have 2 sites of disease that are interested in breast-conserving surgery, have ER-positive, HER2-negative disease, and are willing to take adjuvant endocrine therapy. There are a couple of really interesting findings within this study. One, which we could have anticipated, which was that those patients with adjuvant endocrine therapy had a lower local recurrence rate than the population of about 20 patients that did not pursue adjuvant endocrine therapy for ER-positive breast cancer. And so this underscores that in multiple ipsilateral breast cancer, same as in unifocal breast cancer, adjuvant endocrine therapy is important in minimizing local recurrence in ER-positive disease. We also had a protocol amendment in 2015 which allowed enrollment of patients that did not have a preoperative breast MRI. And there were 15 patients enrolled on this trial that did not have a preoperative breast MRI. And interestingly, the local recurrence rate in this group of 15 patients was significantly higher than in the majority of patients on this trial that all had a preoperative breast MRI. And while this was an unplanned secondary analysis, and this group without a preoperative breast MRI is small, it does provide data for us to at least consider preoperative breast MRI for those patients that have 2 or more foci of breast cancer and are interested in proceeding with breast-conserving therapy. We hope that this study will allow more patients to consider their options and not always need a mastectomy, but at least consider breast-conserving therapy if it meets their own personal goals, and allow patients with 2 or 3 foci of breast cancer to pursue breast-conserving therapy.